Good morning, good afternoon, good evening from wherever you are logging in for this live session of OET All Stars. So, welcome to yet another amazing session. And please let me know if you can hear me, if you can see me. Type in the chat box where you're from. I'd be really happy to see all of you, and a lot of familiar faces come back. So let's get ready for a wonderful session today. So we will be continuing with clinical communication today, and there's going to be a lot of great tips for you to get better, both in OET speaking as well as in everyday clinical communication at work, right? So yes, I see Yasmin, Merlin, Sukumar, Rabin from India, good. So this again comes in a great program, as part of a great program of OET, which is called OET All Stars, and IRS Group being one among the few OET All Stars around the world, and the only All Stars category premium preparation provider from India. Is really happy to share a lot of valuable insights. Hello, Maunesh. Hi, Mariganta. Yes, DS Musa from Maldives. Hello, Regine. Great. So today we will be looking at picking up the patient's cues. Hello, Naveen. Good to see you again. Jayanti, good evening. Madhu, hi. Good. Tagaram, yes. From AP, excellent. Right. So what is going to be interesting is that we are going to look at some areas which might have been overlooked a couple of times. Hi, Jarosh, you're from Bangalore. Thank you, Yasmin, for your appreciation. Good evening, Shaimol, Juan. Hi there. Good. So on the screen is a quote from Dr. Bensing, and she has done a lot of research in this area. And she says, attending to patients' cues, particularly emotional cues, has an effect on information recall and may influence adherence to treatment. So your ability to pick up the patient's cues, and they may not come directly, as well as we will see now. Hello, everyone. Yeah, is going to be really crucial, in information recall, whether they remember everything that was discussed, whether how much they adhere to the treatment plan, to the medication, etc. And also, hello, Onchi Bill from Botswana. Sorry about the pronunciation if that's not the right way you pronounce the name. Thank you, Monish, for that. So, and also it is important for, patient satisfaction. So when you have been treating someone, whether you are a doctor or a nurse or whatever, it doesn't matter much. But if the patients have to be really satisfied, then you should be able to pick on their cues. Yes, good evening, Reena. So let's look at why patients use subtle cues during role plays in OET and during a consultation, everyday consultation. Can you type in why you think that is the case? Why don't they tell you directly? Why do they use subtle cues? Yes, welcome everyone. Victor from Nigeria, Manikanta Yadav from Guntur district. Good evening, Rani, and thank you for coming back. Many of you are, regular candidates, students, and I'm very happy to see all of you back. Yes, so please let me know why you think patients use subtle cues. What's the reason for that? If you look at the patient on the screen, she looks a little bit pensive. If you look carefully, she's giving some cues. So if you are a health professional, who is able to read the subtle cues, that's going to be fantastic. Kitty says they want us to recognize, yes. Fasila from Afghanistan, welcome. Yeah, Bia Tijo, good evening. Joan Xavier, they may be insecure to share their problems to an unknown person. Yeah, definitely. That's the reason. Like 2 sessions ago, we were discussing sensitive issues. So in such contexts, they may use subtle cues. Absolutely right, Yuan. And Maya says because they are embarrassed to discuss. Yeah, absolutely. So those are also, scenario situations when patients rely on subtle cues rather than directly telling. Rani says they feel awkward to share. Yeah, absolutely. So that's really interesting. Now I've got another question for you. Now, how do they share their perspective with health professionals? So in the last session, we were thinking about their perspective in detail. Now, how do they share it? MJ Pural from Philippines, welcome. DS Musa says, because they want to express what they feel using non-verbal communication and don't know how to share sensitive information. Yes, to know more about their concerns. You're apprehensive. Yes, Jackie and Myla. Victor says, because it's difficult to demonstrate openness to strangers. Yes. Rudresh, good evening. Right. Hi, Sonia. So can you type in your thoughts for this question as well? How do they share their perspective? By asking many questions? Yes, Madhu? Yes. When you ask questions, of course, they will share their perspective. But are there other ways? That's what we are going to explore as well. Besides questions are really important. I agree. Think of instances when you have encountered patients at work in clinical settings when it was difficult to understand their perspective, and then how did they share with you? Good evening, Revati. Good to see all of you. So let's quickly move on. Shaimol says, while showing so much of concerns, okay, but they show the concern. All right, that's one way they share it. Joanne says, feel them that health professional can help them to sort out their issues. Okay, so but the question is, how do they share it? And Rani says, based on the previous assumption or experience. All right. Most patients share hesitantly until they get comfortable with the healthcare professional. Absolutely, Lara. Sorry. Kitty says, by reassuring the patient. Yeah, but my question is, how do they share? How do they convey? Anu says they don't feel comfortable to tell everyone openly. Yeah. So what do? Myla says they develop a good rapport with the patient and they can open to you easily, all right? Monish says, because of a good therapeutic relationship, yeah. So you need a good therapeutic relationship for them to be open. So them show must be show, I suppose. Shama, them concern and prioritize. Muhammad Ahmed says once the health professional explores it. All right. So now can you answer this question? It's a quick quiz, and I'm sure that all of you are going to get it right. But let's see. Which is the most important element of communication? So in the context of a patient and a healthcare professional, so is it words, is it tone of voice, or is it body language? Just type in the answer, the option A, B, or C. Jackie says by showing them some sympathy and firm assurance. Madhu, facial expressions and gestures. C, B, A. Shabri says body language. B, B, tone of voice. All three are important. Yes, Siddharth, I agree. But which is mostly used? Now, when I say important, it's the percentage of how much is being used, which is being asked. I'm getting all three options, but a lot of B's and C's, right? Just a few A. And that's surprising, actually. I was expecting that many of you would say words are important. Like Madhu, who says words are A is the most important. Sana says it's B, right? Let's see. So, yeah, it is C. It is body language. Maria, you're right. So let's see how that is the case. Now, this is something called the Merabian Formula. So it's called the 55-38-7 rule. And there are other equations or formula as well. Like you hear about the 90-10, which is, body language and tone of voice combined, forming 90 and 10 being words, and all of those different theories. And it varies a lot depending on the situation. So it's not always, the same. Some situations, it could be like, let's say 25 is words, and body language is pretty less. So you can't generalize, but just to compare, or rather to drill down how important body language is. Now, from an OET's perspective, you're not getting marks for body language. But having said that, I'd say that when you have a very positive body language, and your interlocutor would also perhaps even mirror your positive body language, and so that would make it much more easier for you to talk. So now I always don't differentiate too much between the skills you require for OET speaking test from those skills which are required for work. So let's look at it holistically, but it's going to help you in your OET as well, for sure. So we're going to explore a little bit more about this. So let's see how patients share their perspective with health professionals, right? And that's what I was asking a while ago. So they do it in two different ways. They do it directly, and then they do it indirectly. So we're not going to look at the direct route, because it's clear. They tell you right? And of course, we'll go through the direct route later, perhaps. But today our focus will be a little bit on the indirect route, which includes different aspects. But we are going to focus on a few, which are highlighted in the OET's criteria. And so learning to apply that will really help you with the OET speaking test as well. So if you look at the criteria descriptors, you'll see that these are really important. So let's see how it works out. So one route is verbal hints. Right? So, for instance, the doctor says, I've seen the results, you're fine. And the patient says, I'm not sure. So, there is verbal communication. It's a hint, actually. And from that, you'll have to pick up. So, again, that is not as subtle as some of the things which we are going to discuss further down. Thank you, Jamal, for the appreciation, and yes, welcome everyone who have just joined. Right. So the second route is the change in nonverbal behavior. So there would be vocal cues for you to pick up, aspects of body language, intonation, and a whole lot of things. So let's see, for instance, in the example on the screen, the patient just says, so, you know, that it shows some hesitation. That's what I meant to show. And Fasila as well, thank you very much for the appreciation. So, you know, when somebody is hesitant, it's a cue for you to pick on and, pick up and then to explore further, try to understand what the patient is trying to tell you. And as we have seen, sometimes it will help you to, continue speaking for the full duration of the test as well. A lot of candidates sometimes face this concern or problem when they don't have too much to speak. Perhaps you didn't pick up the cues that the patient would have been giving you. So another example is how change in volume, or it could be the tone could change. For instance, continuing with the same example, I've seen the results, you're fine. And the patient says, I'm fine, I don't know. So it's more like, I don't know would be, I'm fine would be stressed, whereas I don't know will not be stressed. So it's like, I'm fine, I don't know. See, I hope you see the change in tone, in volume. So if you have attended lessons on pronunciation and intonation and stress, you know that stress and intonation can convey meaning. The same set of words could be used in different used for different purpose. It could be starkly different idea that would be conveyed just by changing the tone. So this is really, really important, and a lot of non-native speakers may not sometimes really understand what patients are trying to convey, because many languages, such as many Indian languages, could be rather, a little bit flat. So we talk of stress time language and all, which we'll discuss perhaps later, but it's beyond the scope of today's session. But I hope you get the gist of it. And now, before we continue, I've got a short video for you. Give me a second while I share the screen. So it's just coming up for you. Right.
Mrs. Haskett?
Yes, that's right.
Mrs. Haskett?
Yes, that's right.
What can I do for you?
I've come for my repeat prescription.
Which one is that?
I don't know, it's the yellow pills.
Okay.
Actually, while I was here, I've been getting headaches quite a lot lately.
Anything else?
So that is a video courtesy the University of Nottingham. Now, can you identify the non-verbal communication breakdown in that sample consultation which you watched just now? In your chat box, can you tell me what major problems you have observed? Thank you, everyone, those who have just logged in. Munita Desai, thank you very much for your appreciation. Lydia, yes, everyone. So Mohammed says, gesture, all right. No eye contact. Naila, Magdalene, lack of eye contact. Body language, no eye contact. Naila, Maris, everyone, yeah? I agree. So yes, hesitation. Madhu says she's frustrated, but he didn't identify that lack of eye contact. I know. Phoebe says no empathy. Rani says body language inattention. Meso, change of tone, lack of eye contact. Kirti, Jayanti, distraction and gesture. Lara, lack of interaction and eye contact. Seems the doctor is not interested with the patient. I absolutely agree with you. Active listening is missing. Right. Sorry, I couldn't read all the answers, but most of you have observed, made the right observations. Excellent. So I'm going to play another no active involvement. Very true.
Hello, Mrs. Haskett.
So as I play the next one, let me know if you have seen that the issues have been resolved or not. Just give me a second while I just get you the video.
Hello.
Mrs. Haskett, come and sit down, please.
Thanks.
What can I do for you?
I've come for my repeat prescription.
Okay, well, which one?
I don't know, the yellow pills.
Oh, yes, okay. Yeah, well, we can sort that. Anything else?
Well, yeah, I've been getting quite a lot of headaches lately.
Okay.
I mean, I've had them before, and my other doctor said it was migraine.
Mm-hmm.
But I'm having them all the time at the moment, and
Okay.
I was just wondering whether I should come off the pill.
Okay. What makes you say that?
Well, it was my husband. He thinks I should come off the pill because I don't know.
Yes, many of you have said yes, the problems have been resolved. Naila says patient-focused communication, yes. Maria says he's now paying attention to what the patient is saying. Solve the problem, Shini. Thank you, Maria and Shini, for your responses. Yes. Mizuka says with empathy to the patient and paying attention. Yes, Madhu, Maila, everybody, thank you very much. Yes, patient's verbal cues were picked up. Rotimi, yes. So what do you learn? Now, in the second video, you have not been able to watch the patient, but at the same time, you know, you still know that, yes, Shubha, the patient is very stressed. He gave the woman her time and listened to her. Victor, yes, Mr. Active listening, absolutely. So sometimes, you know, of course, you may have to use the computer to enter the patient details and things like that. Make sure that it doesn't distract you from what your primary task is, showing empathy to the patient, trying to understand their perspective, being in a position where, you know, you use active listening skills, and at the same time, you are able to pick up the cues that they give you, and these are very subtle cues. So you'll have to really observe and be on the lookout if there are these cues. So that's exactly what we have seen: eye contact, gaze, looking away. Now, there are reports which indicate that sometimes patients try to strike a gaze, as we have just seen in the example given by Nottingham University, that the doctor did not, you know, connect with the patient's gaze. Thank you, Maria. Yeah, so that's really, really important. So, and at the same time, patients may, you know, not maintain an eye contact as well. So you'll have to be really on the lookout. So another example or aspect is, you know, posture, arms crossed. You might have observed the patient in the video we just watched. After a while, she, slouched and crossed her arms. And there was an occasional glance at the doctor. She was not maintaining an eye contact, but she tried to, but he wasn't maintaining an eye contact either. Kenneth, thank you very much. Amara, thank you so much. Yes, so all these things are really, really important for your professional development as much as for OET speaking, actually. Let's move on to some more aspects. Now, remember, when we talk of body language, gestures, many of you are preparing for OET to move to English-speaking countries, perhaps from other countries where you have cultural differences, language difference, and so people from different countries and cultures may use different gestures. So beware of pitfalls where you could be in trouble using. For instance, in India, people talk of the Indian nod, which in many Western countries might be perceived just the opposite way. So be really cautious about body language. So let's look at some techniques which you can use to improve the skill of picking up the patient's cues. So what can you do? How can you do that better? So that's what we are going to look, and we will explicitly look at two techniques which will help you to pick up the patient's cues. So one is echoing, right? So you are familiar with echoing, I suppose. If you're not, you still would be aware of echo, right? You go to big spaces and you hear your own echo. So that's one technique you can use, and another one is overtly checking. So that's openly checking with the patient based on what you sense. Okay, so let's quickly look at what it is. So echoing is repeating back what has been said. So the patient says something and then you repeat that. So how do you do that? And that can be again done in different ways. So one way is to add emphasis. I gave you an example a while ago on how to add emphasis, but I'll explain that again. At the same time, thank you, Kenneth. Thank you, everyone, for your responses as well. I'm unfortunately not able to read all of that right now. So you can add emphasis, or you can emphasize and echo, or you can convert the statements into questions. So they would have stated something, they would have said something, and then you can convert that into a question. So I've got a few slides which will explain that as well. Yeah. So in this example, the patient is saying, it's like something's floating in her head. So this is the statement, it's like something is floating. Now the health professional is adding emphasis and echoing. Something is floating? All right, so you could be curious about, the symptom. So you ask, something is floating? Okay, so that's one way in which you can echo with emphasis, right? So you emphasize something which they have just said, making sure that you're trying to pick up the cues. Or converting to a question. So again, it's like something is floating. Did you say that something is floating? So So you rephrase the patient's statement into a question. So it's an arrow, it's not a greater than symbol. I'm sorry. I hope you will use these two techniques or methods of echoing. Try it when you do a role play, when you're practicing with your friend or with a teacher. Try this. You know, they might give subtle cues and then you can do this. So you're going to be, from OET speaking perspective, a high band candidate, scoring really high marks in OET speaking. And at work, you're going to be an excellent healthcare professional, because these skills are for workplace as well. Right, so let's look at the second major technique, which is overtly checking. So by that, it's openly checking out statements or hints. Now, the example I am using are statements, but sometimes it could be just hints as well. So here it's like, I did take the medicine that was given. So that's the statement. The patient says she took the medicines that were given. And the healthcare professional is checking on that statement and asking, or, you know, it did not work, I suppose. So the patient is unhappy and she says she took the medicine. So the health professional is trying to assume, trying to guess if this is what she's coming to. And so make a statement, it did not work, I suppose, right? So you're unhappy with it. So that's again really helpful for you. I did take the medicine that was given, the same statement from the patient, and so the healthcare professional would ask, do you want me to prescribe something else? Right, so it's a question based on that. Hello everyone. Sorry I couldn't read all the comments coming. I'll read them later. But if you have any questions, please keep it for a bit later. We are almost done with it, but I want to make sure that you are able to apply these things. So your task could be, I'm not giving a role play today, a role play card, but in the previous lesson, which was 2 weeks ago, you can still go and watch it on OET's Facebook page. The videos are recorded there. So there was a role play card there. And it is a patient who is preparing for a pediatric surgery. So with a friend, with someone, you can try to practice that, and you can ask your partner, your friend, to have some subtle cues. And you can then try these techniques of picking up those cues and, you know, either restating it or asking questions based on that. So that would be really, really great. And you'll find that your level of confidence in handling speaking would really increase, because this is a tool which is often ignored or under looked. And thank you very much, Adria, for your words of appreciation. So this is really, really important. So before we wind today's session, I'm going to give you a takeaway. Now, Dr. Helen Reis, she has written this book called The Empathy Effect, and she has created this mnemonic called empathy. So that is used in a lot of context. So think of empathy, think of eye contact, facial expressions. So M is for the muscles of facial expression, posture, affect. So if you're not sure about what affect is a term used to denote the emotional state, or how to describe what they are going through, like somebody's excited or worried, concerned. And again, tone of voice, hear the whole person. So active listening, many of you have been talking about that. And your response, what you respond as well. So thank you, Madhu. Thank you very much. So you can try this. This is something you can always remember. Teach other colleagues. You can do a presentation based on this at your workplace, because this is one area which is really, really, really important. We looked at the importance of body language, but still it's not just in some countries but across the globe. Thank you very much, Shubha. Thank you very much, everyone. Kirti, so remember this. This is a wonderful book to read as well, so you get to know her perspective. She's from America. I think she works with Massachusetts University Hospital, right, and a world famous speaker as well. So remember empathy, remember eye contact, remember facial expression, remember posture, affect, tone of voice. You hear the whole person and your response. So that's going to be really, really amazing. It's going to improve your OET speaking scores as well tremendously, because I have seen a lot of candidates just being concerned about the task given. Of course, the task is what you have to do, but remember that there are nuances, there are subtle skills which should not be ignored. Those are very, very important. And that is the reason why you have marks for clinical communication in OET. And at work, this is going to improve your performance. I'm absolutely sure. I've seen that, and I have seen the lack of it as well in clinical settings. Right. So I'll take your questions, but before that, if you have any preparation needs for OET, IRS Group is still continuing a lot of classes online, so you can go to a virtual app which is available on Play Store. You can search for IRS Learning or go to the website irslearning.com. You can select one-on-one trainings from expert teachers who will help you to master OET skills. You're going to succeed in OET, but at IRS, it's not just about helping you to pass the test with our training, but it's also about making you learn those skills. Mastery of the skills is really important and core to our training methodologies. So it's question time. Shoot your questions. I'd be happy to address and answer some of your questions, probably on speaking, especially. Thank you very much, Maria. Thank you, Bismi. Oh, thank you, Rani. Kirti, thank you very much. Thank you for your good words. It's really something that would motivate us to do better lessons for you, so that you will improve as well. So if you have any questions on speaking, I'd be happy to answer those. How can you improve on some of your skill areas, core skills, or there would be a lot of questions which are sometimes common as well. Thank you, Maria. The next one would be coming soon, in 2 weeks' time. Thank you, Tuna Jojo. Jayanti, how to cope up for 5 minutes in speaking. All right. I'd say, how do I cope up for an hour with you? Right. So, Jayanti, you should not be too much bothered about 5 minutes. Focus on the task given to you. And so, any role play task could be a verb. Find out, reassure, all those things. So, what you can do is imagine that you're talking to a real patient and not an interlocutor. So, you have a real patient, you have to address the patient's concerns and complete the task. And then, when I try to do role plays with my candidates, I find it hard to finish. I might go on and on. So when you focus on the task and think of this patient requires empathy, or the subtle cues have to be picked up, like what we discussed today, you will find that your mindset shifts away from the 5 minute, which could be a worrying factor. So when candidates think, oh my god, I have to speak for so long, that could be a limiting factor. So don't focus on that aspect, but think of the things you have got to do. Yes, Maila. So how can you be more confident? That's what I just mentioned. When you are, in that frame of mind, when you are really talking to a real patient, it won't be as hard as you imagine. Yes, Devang, clinical criteria is something which is assessed. Thank you, Maunish. Thank you very much. Ahmad says, what is the best way to practice for speaking? Anju says, at the end of the role play, is that okay to ask the patient to repeat back the information discussed? Yes, absolutely. Whether the candidate, not really. For instance, we talk of chunking and checking, and also, you wrap up, with a recap. So that's absolutely fine. Did I miss something? Oh, yeah. Ahmed, what is the best way to practice speaking? It depends on which skill of speaking you want to improve. If you want to improve your fluency, you can probably do, mirror practice. You can speak to someone, and all those things. But you also need to know which area has to, improve. So if you are in a training, you have a teacher or someone supporting you, you could also ask them for their feedback, and they would tell you, like, you need to work on this area. Nusrat says, can we ask extra questions if we are done with the role play card? Ideally, if it is something related, you can probably, but something which is unrelated to the role play card might not be really good. So my suggestion would be to practice speaking so that you don't finish it off too fast. And if you follow the things, the suggestions, the what I have been sharing with you today, and also in the previous sessions, and also many All Stars providers in other sessions, you don't have to really be worried about whether you will be able to speak only for, let's say, 3 minutes or 4 minutes. That won't happen. So work on that footing. No, Devang, your facial expressions will not be assessed in OET. You're welcome, Sheila. Yes. Kavita, yes, you're welcome. Thank you so much. Rijesh, if you have hesitation during the role play, will it affect the score? It depends on what sort of hesitation it is. If you're stuck for language and it shows your inability to produce language, it may affect your score. At the same time, if you are showing hesitation, let's say like a lot of candidates ask about breaking bad news and things like that, there would be some hesitation, which is natural to that context, and that it'd be fine. So it depends on what hesitation exactly it is. Or even when you are picking on the patient's cues, you might hesitate a little bit. It's not hesitation, but it's like you are gathering those cues. Right. So fine. So I think I have addressed all the questions. I hope I have not missed. If you have more questions, please make sure that keep them ready for our next session as well. It was wonderful to see all of you and to interact with all of you. No more questions are on the way. Nusrat says, does the interlocutor assess our speaking, or are they they're just going to be there? They're not going to assess you. Trained assessors will assess your speaking based on the recording. Do you need a perfect grammar for OET speaking? Again, grammar is important, but it depends on what the perfect is. When grammatical errors and mistakes come in the way of comprehension, that's going to be really difficult. So focus on areas where what you speak should be intelligible, and grammatical inaccuracies should not come in the way of your intelligibility or change the meaning. So yes, sometimes even a simple tense mistake could cost you, because technically you would have killed the patient. So that's an example which I sometimes use to show how nuanced you can be with grammar. For instance, you tell somebody that this is the medicine, and this is from a writing context where you're writing that this patient was on a particular medication, and the receiver might think that okay, was on that drug, which means currently the patient is not on that drug. And imagine that the new caregiver discontinued the drug, and it had adverse reactions or complications. So yes, just a simple tense slip, but it would have affected the patient's health in a big way. Can you paraphrase the questions? Absolutely, yes. But again, remember when you're paraphrasing, for example, the role play card says the patient has limited mobility. Now, some candidates try to paraphrase it, okay, limited. Let me use restricted. Now, limited and restricted are not exactly the same thing clinically. In English language, yes, they could be used interchangeably, but as a healthcare professional, it might have a different meaning. So be careful that you just don't paraphrase for the sake of paraphrasing, but if it's going to help you, improve your communication, certainly yes. Now, if you have a technical term, technical jargon, of course you have to use layman's language. Yes, right, sure. You're welcome, Mary and Mr. So thank you very much, everyone, for your time and having me spend this time with all of you. I look forward to interacting with you shortly for the next session. So make sure you check out on OET's event updates. And if you need any training help, remember to log in at IRS Learning. Thank you very much.